Look at your nails right now. Not later. Not tomorrow. Right now. Most people look at their nails only to check their appearance. They notice a broken nail, a strange mark, or something that needs fixing before going out. But your nails are more than just a cosmetic feature. They can sometimes reveal clues about what is happening inside your body. Changes in color, shape, texture, and growth can be connected to problems involving your blood, hormones, nutrition, circulation, and immune system. Many people ignore these signs because they seem small, but sometimes the smallest changes are the first signals your body sends. Your nails are constantly growing, and the visible part of your nail contains a record of what happened during the months before. The question is, do you know how to read those signals? Before we look at the warning signs, let's clear up one common myth. Many people believe that small white spots on nails mean calcium deficiency. That is usually not true. These spots, called leukonychia, are often caused by tiny injuries to the nail matrix, the area where your nail is formed. A small hit, pressure, or aggressive manicure can create these marks, and they may appear weeks later as the nail grows. But not every nail change should be ignored. Some patterns can deserve medical attention. Here are 7 nail signs you should never overlook. Sign number 1, white lines or completely white nails. A small white dot is usually harmless. But if you notice horizontal white bands crossing several nails, that is different. These lines can sometimes be associated with conditions affecting the body, including nutritional problems, kidney issues, or exposure to certain toxins. Another important sign is when the entire nail becomes pale white and loses its normal pink color. Healthy nails usually have a pink tone because blood flows beneath the nail plate. When that color disappears, it can sometimes indicate changes in circulation, blood composition, or liver function. Your nails are not diagnosing a disease by themselves, but they can be a reason to investigate further. Sign number 2, yellow nails. Yellow nails are common, but the cause matters. Sometimes yellowing comes from nail polish or staining. Other times it is caused by a fungal infection, where the nail becomes thicker, harder, and more fragile. For people with diabetes or circulation problems, ignoring a fungal nail infection can create bigger complications because damaged nails and surrounding skin can allow bacteria to enter. In rare cases, yellow, thickened nails combined with swelling in the legs and breathing problems can be linked to a condition called yellow nail syndrome. The important question is it only a cosmetic change, or is your body showing you a bigger problem? Sign number 3, blue or purple nails. Your nails receive their color from the blood flowing underneath them. When oxygen levels in the blood are reduced, nails can develop a blue, gray, or purple appearance. This can happen with several conditions affecting the lungs, heart, or circulation. If your nails suddenly change color and you also experience shortness of breath, chest symptoms, or unusual fatigue, it should not be ignored. Your nails may be showing that your body is struggling to deliver enough oxygen. Sign number 4, dark lines under the nail. A dark vertical stripe running from the base of the nail to the tip is often harmless. In many people, it is simply increased pigment production. However, one specific pattern requires attention. If a dark stripe becomes wider, has irregular borders, different colors inside it, or spreads on the skin around the nail, it should be checked by a dermatologist. A rare but serious form of skin cancer called subungual melanoma can develop under the nail and may look like an ordinary dark line at first. The difference is that dangerous changes usually evolve over time. Do not panic, but do not ignore unusual changes. Sign number 5, spoon-shaped nails. Look at your nails from the side. Are they curved normally? Or do they look like a small spoon, with the center dipping inward? This condition is called oncologist. One of the most common associations is iron deficiency. Iron plays an important role in many body functions, and when levels become low, changes can appear in tissues, including nails. Spoon-shaped nails can also appear after long exposure to harsh chemicals without protection. If your nails are changing shape, it is worth asking why. Sign number 6, club nails. Now look at your fingertips. Do your nails appear unusually curved and rounded, almost like a glass surface? Does the fingertip itself look larger or swollen? This is called nail clubbing. It happens when tissue around the fingertips increases. In some cases, it can be associated with long-term problems involving the lungs, heart, or other organs. A simple test is called the Schamroth window test. Place the nails of two matching fingers together. Normally, you should see a small diamond-shaped space between them. If there is no space, it may be worth discussing with a healthcare professional. Sign number 7. Ridges, pits, and nail surface changes. Run your finger over your nails. Do you feel deep lines, small holes, or unusual texture? Some vertical ridges become common with age and are usually harmless. But sudden changes can sometimes point toward nutritional problems, inflammation, or autoimmune conditions. Tiny pits in several nails can appear in conditions such as psoriasis or other immune-related disorders. Horizontal grooves, known as Bowes lines, can appear after the body experiences a major stress event, such as severe illness, surgery, or intense physical stress. Your nails grow slowly, which means they can preserve evidence of what happened months earlier. A 5-minute weekly nail check. You do not need special equipment. Once a week. First, check the color. Are your nails still pink and healthy looking? Second, check the shape. Any unusual curves, sinking, or swelling. Third, check the surface. Look for new lines, pits, cracks, or separation. Fourth, compare both hands. Is one side changing differently from the other? Fifth, take a photo. Tracking changes over time is much more useful than relying only on memory. Your body communicates with you every day, sometimes through pain, sometimes through fatigue, and sometimes through small changes you almost never notice. Your nails are not just decoration. They're a small window into your health. The goal is not to diagnose yourself from a single sign. The goal is to notice changes early and know when it is time to ask questions. If this information helped you, share this video with someone you care about, because a small warning notice today could make a big difference tomorrow. Subscribe for more health information that helps you understand your body better.